So I'm going to start with my journey. And as mentioned, I am the Vice President of Integrated Delivery Operations at University Hospitals. I'm also still a practicing nurse practitioner in the emergency department. And when I think back on why I chose to become a nurse, it was a pretty easy decision for me. My mom was a nurse, and I saw really all the qualities that I wanted to emulate: her compassion, her care, and her leadership. Now that I've been in nursing for almost 20 years, becoming a nurse was an amazing experience and choice for me, and one of the best decisions I've made. As a child, I was always curious and inquisitive. I was also seen as a natural born leader, but I did not ever think I would be a formal leader in any way. When I reflect back on my journey, my pathway was not a straight line, but more of a curve. I did get my BSN and my first job as a nurse and began in the neurointensive care unit at the Cleveland Clinic. I then became a clinical educator and was hungry for more experiences in both my personal and professional life. And I decided I need a little change of scenery. So I experienced travel nursing and took an assignment in Florida. And later I wanted to give leadership a try. I became the critical care nurse manager and took on additional responsibilities as the neuroscience director and grew my skills building stroke programs while leading a variety of other things I had absolutely no experience in, like employee health, an outpatient spine clinic, an orthopedic surgical floor. And throughout my journey, I challenged myself because I thought I could do a better job advocating for my team and my patients. And I embraced the idea of leaning in and was not always the expert or had the experiences in those areas, but I remained open to learning. And it was not an easy pathway into formal leadership because many times the skills that got me farther in my clinical practice weren't necessarily the skills that made you a good leader. So I had to go on a journey to improve my communication skills. And that's been with the help of 360-degree evaluations. I've had a leadership coach for several years that I rely on heavily. I find very good mentors within and out of my organization. I like to listen to podcasts on leadership. Brene Brown is one of my favorites, and reading some good leadership books. As I said, through each of my transitions of leading different things, there was always fear and anxiety. The voice in my head would always question, will I be good enough? What if I fail? How would I go back? What if I can't do it? I had imposter syndrome much of the time, and to be honest, I still do sometimes. During each of these transitions, it was important to find my mentor and change the voice in my head. And my mentors really helped me to reflect on my own strengths and to find my path. I did choose to become a former leader to advocate, as I said, for our profession, and most importantly, our patients and our teams, but also to influence change in a positive way. What I found in my leadership journey is what Johnson & Johnson has been saying was right. Every nurse is a leader. You will all make decisions that affect others and take them to places they never thought they would go. And in my mind, that's the very essence of leadership. Your patients and the interdisciplinary team rely on you to lead them. The nurse in many ways coordinates and manages a wide variety of care for the entire team. And even in informatics, you are conducting an orchestra to support the entire clinical team. And leadership is a part of what you do each and every day. Applying the same principles that all nurses are leaders, whether the focus is at the bedside, in our IT systems, case management, or formal leadership, the influence and impact we each have is important to the systems of care and most importantly, the patient. As a VP of Integrated Delivery, I am in a unique role that builds on my passions and strengths to challenge the status quo, innovate, and transform. I have influenced and lobbied for the nursing licensure compact in Ohio to improve access to nurses in our communities, and got to witness the bill being signed on July 1st of this year. I have been able to build innovative models of care with the use of telehealth and remote patient monitoring technologies with interdisciplinary care models. I've been able to create strategies that work to improve healthcare for our patients and begin to solve the $1 trillion problem we have.